So.
There you go.
All right, hi, everybody. Great to see you all. Happy New Year. It's been I ain't seen y'all since last year. I like saying it. I will call to order this meeting of the statewide substance use response working group scheduled for January 10th, 2024 at 2 p.m. Can you please call the roll?
Chelsea Cheatham. Dr. Dixon.
Here.
Senator Doniake. Attorney General Ford.
Here.
Senator Severs Gansert.
Here.
Assemblywoman Hardy. Shayla Holmes.
Present.
Jeffrey Iverson. Jessica Johnson.
Present.
Dorothy Edwards.
Present.
Nancy Lindler. Debbie Nadler. Angela Nichols.
Present.
Christine Payson.
Christine just connected to audio. Can you call her name again?
Sure, Christine Payson.
Present.
Eric Schoen.
I'm here.
Steve Shell.
Here.
Dr. Slamowitz. Assemblywoman Thomas. Okay, Mr. Attorney General, we do have a quorum.
Excuse me just a moment. Deanna, can you send Deb Nadler the link? She just notified us that she can't find her link and she'll call in. And Jeffrey Iverson was going to call in again too, so we may want to watch just to make sure that when those two come in.
Okay, I'll get Deb's out right now.
All right, thanks so much. With the quorum, we will move on then to agenda item number 2, public comment. Public comment shall be limited to 3 minutes per person. We'll begin with comments from Las Vegas and then invite comments from Carson City, followed by virtual participants. If you're here in person and you want to give public comment, please form a line. And before commenting, please state your full name for the record. If you're attending virtually, if you're dialing in from phone, you can dial 719-359-4580. When prompted, enter the webinar ID, which is 841-1615-6896. Then enter the meeting passcode, which is 676835, and press the *9 button so the host can prompt you to unmute. If you're joining virtually with computer audio, please use the raise hand feature to indicate you'd like to provide public comment so the host can prompt you to unmute. And before commenting again, please state your name and please state your full name for the record. Comments can also be emailed to lhale@socialent.com, and these comments and questions will be recorded in the meeting minutes. And with that, do we have anyone here in Vegas for Carson City for comment? Yes, you know what I mean.
I'm in Las Vegas. I'm not moving to Carson. Thank you, Mr. AG and the SURG Committee for the opportunity to speak briefly with you today. I'm Dr. Maureen Strong, and I am the family physician and addiction medicine specialist. And here in Las Vegas, the training program director for Nevada's first Addiction Medicine Fellowship, based out of the Sunrise Health GME Consortium and Southern Hills Hospital. In addition, I am the president of the newly established Nevada chapter of the American Society of Addiction Medicine, which really looks forward to bringing together the collaboration of all of our stakeholders in the city and throughout the state to address the care of patients, families, and our communities impacted by substance use disorders. And first of all, I'd like to applaud the work of this committee in the working towards better services for our patients and their communities. And particularly, I wanted to speak to the preliminary recommendations submitted at last month's meeting. I strongly support the concept of increased access to MAT, buprenorphine, through the encouraged use of a hub and spoke and recovery support model, which is really quite fragile here in the state. We have few, if any, truly established bridge programs between our emergency departments and the community. And a good part of that is a lack of the spokes, particularly within the primary care communities. We need to bolster the provision of MET services among our primary care physicians, regardless of the setting that they are in, particularly when those facilities and practices receive funds through federal and or state mechanisms. We have the resources to provide training to those physicians to increase their knowledge, skills, and attitudes towards the provision of this medication for a chronic lifelong disease, not unlike diabetes. And my efforts to promote it as this is one medication we're talking about. It's not 4 categories that you've had to learn for diabetes. And we can have some similar outcomes, which we see when people are best managed. We have the key stakeholders involved. I also work with Dr. Dixon at BHG in methadone clinic. I have been part of a preliminary emergency medicine MAT bridge clinic process with Dr. Kelly Morgan out of Valley Hospital and working with the residents there, and Dr. David Hart at Mountain View. But it's not enough. We need to work towards improving our primary care infrastructure with our community physicians. We've seen that the elimination of the data waiver has maybe eked out a little bit more provision of these medications by our ER docs who are now more comfortable in prescribing, but there's a long way to go. It has made no difference within the primary care community. So we look forward to participating with you and looking at remedies that can enhance that. Thank you very much.
Thanks, Doctor. Let me get you to spell your name for the record so we can get it annotated correctly.
Okay, my name is Dr. Maureen Strom, M-A-U-R-E-E-N. Last name Strom, S-T-R-O-H-M.
Thanks, Doctor. Appreciate your comments. Anyone else here for public comment? And yes, sir, go ahead. Giuseppe.
Giuseppe Mandel, American Addiction Centers, Desert Hope here in Las Vegas, Nevada. Thank you guys all for being here and allowing me to be a part of your meeting. Look forward to learning everything that I can. And I think the state has made strides in the field right now. I really do. I think they make strides, and I'm out there in the field and I see it daily. So,
Well, thank you. We were used to seeing you at our meetings now. I appreciate you continuing to come and participate. As an aside, I will say thank you for your interview that you did with the news station recently. I thought it was very compelling. So
likewise.
thank you. All right. Anyone else here in Vegas for that? Okay. Do we have anyone in Carson City for public comment?
No public comment in Carson.
All right. Thanks. Do we have anyone on the phone for public comment?
Mr. Chair, Kelly Marshall for the record. We don't have anyone on the phone, but we do have a hand raised. Marcy Ryba.
Okay. Let's go ahead, Marcy. Marcy, you can go ahead with your public comment.
Hi, Chair Ford. My name is Marcy Riva, and I serve as the Executive Director of the Department of Indigent Defense Services. We are working with public defenders across our rural communities to provide them with resources. And as we all know, many individuals that have been involved in this opioid epidemic have ended up incarcerated facing criminal charges as a result of their opioid addiction. When you're looking at item number 6 of considering statutory changes to expand the SURG membership, we are hoping that you'd consider bringing public defenders to the table so that we can be part of the solution. We'd request that you expand the membership to include the Department of Indigent Defense Services or a designee, possibly a rural attorney that's nominated by the department. And we also think it's important to invite urban county public defender representatives. Public defenders play an important role. Many times they're the first ones that have contact with these people that are addicted and talk to them about the addiction and get them into treatment. So we're just hoping to provide more resources to our rural public defenders so that we can effectively be part of this solution in solving this crisis. Thank you.
Thank you for your comments. We greatly appreciate it, and we have noted that for purposes of discussion later. Any further comment on virtual comment? Okay. Hearing and seeing none, then we will close public comment and move on to agenda item number 3, which is a review and approval of our minutes from our December 13th, 2023 SURG meeting. They've been distributed to you. Please review, and once appropriate, I will entertain either amendments to it or a motion to approve.
Dr. Dixon, I'll move to approve.
Dr. Dixon has moved to approve the minutes. Do I have a second?
Debbie Nadler. Whoops.
All right, Debbie Nadler will second it. Any discussion on the motion? Hearing and seeing none, all in favor say aye. Aye.
Aye.
Any opposed, say nay. Any abstentions? All right, motion carries unanimously. Thanks so much. All right, we are going to, I'm gonna use some chair's prerogative here and move up Mark Kruger in the agenda. He has a conflict and we need to go ahead and have him.
Actually, he says 2:35.
Oh, 2:35?
Yeah, so-
Okay, all right, we will call him at 2:35.
Yeah, General, actually, anything after 2:35 is great. So it sounds like I'm 8th on the agenda. I should be back by that time and everything will be fine.
Okay, great. Thanks so much, Mark. Okay, moving on then to agenda item number 4, selection of our SURG vice chair. I know that we have, we have a suggestion of Steve Shell, who's expressed an interest in becoming the vice chair. I will entertain a motion to appoint Mr. Shell as vice chair. Is it a motion required for this?
You can appoint.
I can just appoint. Never mind. I'm not entertaining a motion. I'm just going to appoint Steve Shell as vice chair of the SURG committee. Mr. Shell, are you there?
Yes, I'm here. Thank you, Chair Ford.
Do you accept my appointment as a vice chair?
Yes, sir, I do. Thank you.
Well, good. Thank you so much. Welcome to the vice chairmanship, Mr. Shell. We appreciate you, and thank you for all your continued work on the committee.
Thank you very much, Chair Ford.
Okay, moving on. Agenda item number 5, proposed equity lens from the Office of Minority Health and Equity. We have allotted 20 minutes for this discussion. We have Tina Deutsch, who's the program manager of the Office of Minority Health and Equity from the Department of Health and Human Services, prepared to present to us, and I will tender you the mic.
Good afternoon, Mr. Chairperson, and SURG members and guests. Can everyone hear me?
We can. Thank you.
Thank you. Thank you. As the chair said, I manage the Office of Minority Health and Equity. I'm a part of the Department of Health and Human Services, for those who don't know. And my statutory mission is to address disproportionately experienced health-related disparities. But we were also named in 2021 through a piece of legislation, SB 390, to identify members to sit on the Advisory Committee for Resilient Nevada, or the ACRN. So just giving you that as a bit of context and to show that there's a bit of statutory synergy between my office, this group, and the ACRN. Excuse me, my sensor went out, Mr. Chair, I apologize. And on the topic of substance abuse and misuse. But today I'm here to present to you, as the chair mentioned, an equity lens for your consideration. And if you don't mind going to the next slide. So there's an opioid settlement that has been the subject of a lot of conversation. It's a huge undertaking and it involves input from several entities, including this body, the ACRN, and I mentioned DHSS, but the Grants Management Unit. Now, each of these entities, they share a commitment to the equitable distribution of these resources. And that's why having this equity lens is going to be very beneficial, as it's going to help us provide equitable consideration to our most vulnerable communities and those who are most marginalized. Now, beyond the legislation that I mentioned a few minutes ago, and my appointment of people to the ACRN, we've been enlisted to create this not only by your organization, but by ACRN. So there's 2 organizations that are currently considering use of this particular health equity lens. And the way that you would use it is to infuse, or we would say embed, equity into those critical functions and at critical pivotal milestones, specifically during times of priority setting or action planning or the development of recommendations. And Mr. Chair, I present to you that this is this latter function that is of relevance to the SURG, because in reviewing your 2023 action plan, your purpose remains that of making recommendations for the establishment, the maintenance, the expansion or improvement of programs, and the use of resources to address substance misuse and substance disorders across the state. So I just want to now give you a little bit more context, everyone. And within the equity space, a key principle that we work with is the utilization of something called choice point and choice point primes in particular. So you might ask, what is an equity prime? Well, they typically present in the form of a question. They tend to serve as a prompt, and they simply but effectively remind a decision maker to avoid bias. And then as a debiasing tool, it allows the user to be held accountable by methods that rise above bias and subjectivity, while still evenly weighting the consideration of those who are in positions that are historically less powerful or have a limited voice. So engaging in equity prime is a process that evokes or prompts the intentional consideration of potential impacts on those marginalized populations. And when you practice it consistently, evidence shows that their use can become standardized when carrying out functions like yours in the development of recommendations. So specifically, these choice point primes, they cause us to stop at each critical decision-making point in a decision-making process. And they allow you to make those decisions that remove bias, but promote equity. And then another thing to consider as you weigh the option of using this particular tool is that choice point primes have an added benefit of promoting allyship. In essence, they allow that dispersion of privilege, or perhaps someone who doesn't have the same lived experience, to work in solidarity and partnership with a marginalized group or people who in the system and need to have those disparities reversed. You also are able, through this allyship position, to challenge any of the basic rights that have been withheld from these individuals, to make sure they have equal access. And in the case of your work, to make sure that they do not have limited access to achieve and maintain their recovery. So I believe you also have at your disposal, Mr. Chair and members of SURG, a choice point application guide. That is just for your use after this presentation ends. And I think that if you look at that, you'll see there's a very interesting example. It's something called the implicit bias bench card. And in this particular example of a choice point thinking process, it's used by judges. And so those judicial officials use it to ensure that they're making deliberations that are unbiased. And so just an example of how other sectors are using it. And I see we've moved on to the next slide. Thank you very much. So as you embark on your work and you agree to make deliberate choices, that is the goal. And to avoid defaulting to what we refer to in the equity space as status quo or autopilot decision-making. Instead, we want you to seek to reach a conscious, equitable outcome that takes into consideration the needs of all of Nevada's residents in all their diversity. And so what does it look like in practice? I've got 4 examples there that talk about what it looks like in practice. And the first one is about committing to achieve a bias-free outcome. So when you find yourself defaulting to status quo, you start asking yourself questions. For example, who stands to benefit from the choices that are being made if I do this in autopilot setting? And will doing so present negative consequences or create unnecessary barriers? The second thing you need to consider is that identifying decision maker points of contact. These are those access points, and they're the points of impact where historically underserved communities don't have the ability to have their voice heard, and you bring their voice to the process. Mindfully examining your choices, and then also making sure that once you know better, now you do better. And that is the definition of acting equitably. The last thing I want to say about this slide, everyone, is that I really find it to be an effective cue when we're talking about choice point thinking. I even go so far as to recommend that you place this image maybe in future agendas or in your work group meeting materials. And by doing so, you can ensure that that type of thinking becomes a standard protocol, and that regular use of these type of choice point primes, well, they can remind you to pay attention to things that might be biased and they'll also help you to react in a strategic way to alleviate them. Next slide, please. So to be effective and resilient, an equity lens has to have a couple of things. And one of those things are these categories. These categories serve as the choice point primes that can assist you and members of SURG. On the screen, I've given you 7 sample categories. And these are created and to again present an equity-focused consideration is part of your process when you're making decisions. And remember that each of those decision-making points is another opportunity to ensure that your actions serve to remove bias and promote equity. And by having so many opportunities to make that type of a consideration, you're removing subjectivity from the process. As mentioned earlier, you're going to get a guide, or if you haven't received it, we'll make sure you have it. And within that guide, you get a lot more examples about other types of choice point primes. But we just wanted to make sure we had something to continue with this particular presentation. It's my understanding that in order to do your work as SURG, that you've divided yourself up into 3 subcommittees. It's prevention, it's treatment and recovery, and it's response. And what I recommend that you do is that you consider having the 3 subcommittees when you start working on perhaps next year's recommendations, that you do it by adapting to choice point thinking. Now I'm going to use the next few slides to A, introduce you to the template that we've created, and B, to walk you through a couple of examples about how to employ this particular process, especially as your subcommittees go about their work. So this is the template, and it can be found in the guide, but you can also feel free to customize a design that works for this particular body. The first row, it reflects, again, those categories or those primes that should align with all the opportunities to make a decision, all those decision-making points. And again, on the previous slide, I showed you 7 as an example. That second row, the rationale row, is used to validate that we need to make these categories a part of the conversation, and that it provides that those categories impact equity and bias and make sure that bias does not creep into those recommendations. And again, it also validates that those decisions and those recommendations weren't reached through just sheer subjectivity. That third row, this is used to identify the function. What are you going to use this to do? And in most cases, again, SURG members are going to be using this process to reach your recommendations on an annual basis. And then that 4th category, that 4th row, these are those questions that, again, I really implore you to customize, but they're used to filter your recommendations, and they're the last step in making sure that those recommendations are equitable. So we're going to go to the next slide. And on that next slide, we're going to start filtering just a couple of your 2023 recommendations through this process. So I promise you, I did not do all 23. I think there were 23 in the current set of recommendations, but I am going to use 2, and I am going to use them just with those 2 prime points that are on your screen right now. So if I can have you go back to the last slide, I just want to have a visual so you can follow along. Thank you very much. Again, I'm only going to use 2 of your recommendations as an example, a working example. And the one that I picked was recommendation number 14, and it reads, implement follow-ups and referrals and linkages of care for justice-involved individuals, including individuals who are leaving the justice system. So if we were going to work backwards and say, is this a equitable and just recommendation? The first category of questions in that line number 1 is SURG capable of influencing the decision or recommendation? And then to justify that you are, you ask yourself, have our subject matter experts who sit on the SURG body, have they identified the entire possible realm of opportunities where we can actually influence and make a recommendation that has impact? And have you considered the needs of those marginalized populations in doing so? Again, that third line says, and how are you going to use these decisions and responses? You're going to use it to make sure you've developed an equitable recommendation. So then that last category is just asking yourself questions. And the one that I have on the screen that I'll just work through is, what disparity could be exacerbated if the impact of the recommendation I just mentioned wasn't truly universal or equitable. Well, as you work in your work group, you will answer many disparities would be significantly exacerbated if this recommendation's referrals and sources of care weren't equitably applied. And so what makes this recommendation equitable is that it is the intentional inclusion of phrases like the justice involved individual in that particular community. So I would say that this is a recommendation that should be retained, obviously, if we were in the design phase. But I would actually say, should there be others, or should this one be even more inclusive to go beyond just this reference to this community? And then if you would just allow me one last example, I'm using recommendation number 16 from your 2023 list, and it read, establish priority funding areas to ensure that BIPOC and the LGBTQIA community receive culturally and linguistically appropriate prevention services. So again, the first question is, does this recommendation identify all of those potentially impacted? And I would say the rationale is to more thoroughly connect people, you have to be able to recognize the full spectrum of diversity in our communities. And the more equitably and broadly you do that, the more equitably and broadly those decisions are going to be delivered and developed. So you're doing it to, again, make sure your recommendation meets those standards. And I would say, yes, you are. As you read that question, the full expression of sexual orientation and gender identity is reflected there. And you also go into ethnic and racial categories as well. So by using this particular recommendation, you are ensuring that it will be an equitable impact on the community. So if we go to the next slide, I'm going to take a beat there and just say, we're not going to go through these specifically. I just want you to kind of see the screen and understand that as an example, I've given you 7 potential filterable categories. On this screen, you see the social determinants of health. How are your recommendations having an impact on all those determining categories? Or community integration. Are your recommendations actually taking into consideration historically underserved communities? And is their voice being reflected in your recommendations? Next slide, please. And then you do a really good job. I did catch quite a few references to culturally and linguistically appropriate standards already being incorporated into your recommendations. And then that 6th one is accountability. This is one that we often leave out of the equity work that we do, and our recommendations really do need to factor for accountability. So I would ask that you consider making that one of your prime points for consideration. And then the next slide, please. Data. Data is something that we know is so critically important. On the next slide, I'm sorry, Crystal. There we are. So the next slide talks about data, and that we place an emphasis not only on data, but community-focused data. And that is data that's derived from sources like social vulnerability indexing or asset mapping. And by doing that type of work, that equity-focused survey design, and basing your recommendations on that as your validation, you can ensure that then you are showing evidence-based recommendations that take into consideration community impact. And then my last slide is just for questions. I want to thank you for allowing me to present this option. I want you to take away one thing, and that is that in order to avoid that autopilot decision-making process that we all kind of pivot to sometimes, that choice point thinking will allow this group to infuse equity into your decision-making and your recommendation setting. So, Mr. Chair or members, I can answer any questions or clarify any other points.
Well, Tina, thank you so much for your presentation. I will open it up for questions from the committee. Any questions here? I will say that it was listening in my ear as you were working through this for us, that we, in fact, at the subcommittee level, were utilizing choice point thinking of sorts. I don't know if we called it that or not, but certainly we're looking at it from an equitable lens. And so happy to hear that you, at least the 2 recommendations you review, find them satisfactory. So thank you so much for kind of confirming what we had hoped and were working towards. So are there any questions? Any up north or on the screen?
I had a question. I'm sorry that's not working right. It's Debbie Nadler for the record. Can you hear me?
All right. Yeah, Debbie, go ahead.
Okay, just real quick. Thank you so much for that presentation. The question I have is, are we going to have some kind of chart, a number, something that shows us the diverse population being affected, like the percentages, like, I don't know if this is making sense, but is there some kind of chart who we know who's being affected, the percentages?
Tina Dorch for the record. I'm going to repeat the question back to make sure I understand it, if that's okay. Are you
Yeah, thank
asking
you.
are you asking if we as a state maintain records of those from the community who are dealing with substance misuse, and that it's perhaps stratified by race and other demographics? Is that your question?
Yes. And that helps us make the decision too, just to see which I mean, I think it would be important.
There are organizations that do track that information. And in fact, if you again pivot back over to ACRN, as part of the needs assessment, that data was collected and shared to that body as well. So, and I believe that the two groups, you hold joint meetings from time to time. Is that correct?
We do.
SURG and HCRN?
Yes.
And so I would imagine that that information, if it hasn't been shared, could easily be shared.
Okay. All right. Thank you so much.
You're welcome.
Thanks, Tina. Thanks, Debbie. Any other questions? Okay. Hearing and seeing none. Tina, thank you so much again for sharing your information with us. We appreciate this, and thank you so much for the form you gave us here as well. It's going to be useful for us to take a look at that. So thank you so much.
Thank you, Mr. Chair.
Okay. With that, then we will move on to the next agenda item, which is number 6. Consider pursuit of statutory changes to expand the SURG membership. This is for possible action. We've allotted 15 minutes for this. As a reminder, this would have to go through the legislature. Any changes that we want to suggest be made has to be approved by the legislature. We've received a handful of suggestions. Possible additions include the Advisory Council of Prosecutors. We've recently heard today from Indigent Defense and trying to get PDs in there. Other representatives, as noted on the PowerPoint as well, which are up there. Representatives of the public, representatives of a member of family services or foster care, representatives from fire and EMS, and or other suggestions. And so with that, were there other suggestions that folks wanted to have us consider?
Chair, if I can just add in talking to our DAG for this, as we look at the legislation, when we increase membership, of course, our quorum numbers would go up and we would have to meet more than 50%.
Yeah. Good point. Yes, ma'am.
Jessica Johnson, for the record, I'm curious, just for my reference, if there's a list in our report of the current membership. I know it's pretty diverse and we're in a hybrid format, so just wanting to review these recommendations against the list.
I don't know this report. Do we have?
I don't think we do have it in that report.
Not in this
No
particular
worries.
report.
Thank you.
Emma, if you're still on, can you, from your list from quorum, go through and who are the current members?
Or just the categories?
Yeah, they're the category they serve.
Excuse me, I don't have that on the list, but I believe, Laura, is there on the SURG website that you work to update, does that list the categories? And would it be okay if I put that in the chat for everybody to also reference?
Yeah, the link is live now. It was when we checked this afternoon, and that does list all the members. Let me go back and find that.
I have the link and I just want to make sure, I know that there's rules about the chat. Is that all right if I put that in for everybody?
let's not. Instead, I'd refer everyone to page 69 in the draft report. It appears as though there's a link that may take us to where we need to go in order to find membership lists. The SURG membership bylaws and meeting material are available online at the link on page 69.
That link needs to be updated. Chair Ford, sorry about that. That was one item that we had outstanding and it was just updated today. So I don't know if we can bring that up. Crystal, do you have that you can share?
So Kelly Marshall, for the record, I think we can share the page. Like, we don't have to share the link, we can share the page. And in fact, we want people to know that this link exists because we're going to ask you to replace the link that is in the report with this link as part of your adoption of the report. So I think it's timely and useful.
Okay. You want to put it up then?
Yes, I am working on that. I don't know why I don't see it as an option. Oh, here we go.
So there it is. So Kelly Marshall, for the record, so we have a representative of local governmental entity that provides or oversees the provision of human services in a county whose population is more than 700,000. We have a representative of a local governmental entity that provides or oversees the provision of human services in a county whose population is between 100,000 but less than 700,000. And we have a representative of a local governmental entity that provides or oversees the provision of human services in a county whose population is less than 100,000. We then have a provider of healthcare with expertise in medicine for the treatment of substance use disorders, a representative of the Nevada Sheriffs and Chiefs Association or its successor organization, an advocate for persons who have substance use disorders and family members of such persons, a person who is in recovery from a substance use disorder, a person who provides services relating to the treatment of substance use disorders, a representative of a substance use disorder prevention coalition, a representative of a program to reduce the harm caused by substance misuse, a representative of a hospital, and a representative of a school district. So those are the current appointments that we have.
In addition, there are the legislators who are listed below.
Thank you for answering my question so thoroughly. I appreciate it.
Absolutely. So just quickly to repeat, we've had a suggestion to add a member from the Nevada Advisory Council for Prosecuting Attorneys, representative from the public, representative of a member of Family Services or foster care, a representative from Fire and EMS, and then today we heard a suggestion that we include public defenders, a public defender, one or two. I think I heard it say both at the state level and at a county, at a large county level. Any other suggestions? Go ahead, sir.
I have no additional suggestions. I guess I just wanted to note that it's at NRS 458460 that mentions the list of the current members who are on the panel.
Yeah.
I just wanted to point that out instead of referring to a link or anything like that.
Yeah, it's statutorily. Can you repeat that out loud? The statute, NRS.
NRS 458.460.
Yeah, that's the one that detailed everything she just read a second ago about who's supposed to be appointed to the committee and so forth. So we would be looking to amend that statute to add one or more of these suggested positions. And if there aren't any other suggestions, then I will close that out. We'll take note of it as a committee. Yeah, go ahead, Jessica.
Yeah, hi, Jessica Johnson for the record. I'm curious if we could just kind of have some discussion around the recommendations that are up here. And I personally, I've just really enjoyed serving on this board. I think we have a lot of great balanced discussions and really reflect a lot of the diverse opinions and subject matter expertise across the state. So I'm carefully considering sort of what other groups get added and just making sure that it's going to be an added value to the as a current member to the committee, because I do really value the time and the discussions on this particular group. So I was hoping maybe we could just talk a little bit about these particular members and what additional balance we think they might bring, or voices that we might hear that we're not otherwise hearing.
Sure, we could do that. And by the way, we are very far out from the legislative session. So this doesn't have to be the only conversation we have around this. But with that being said, certainly some of these are self-explanatory. The prosecuting attorneys, the advisory council specifically asked because they, in their estimation, don't believe there's a sufficient representation of prosecutions or prosecutors on this committee. And in public comment, we heard their counterpart likewise wanting to be included if we're going to include prosecutors. So there comes a balance, I think,
Yeah.
that you're talking about in that regard. You've heard us. Yes, ma'am. Go ahead.
I have two questions. One is, do we have some vacancies right now? In any of our...
We don't have any vacancies, but if your question is whether any of these would qualify under those vacancies, I don't believe so.
No, I don't think so either. I just am curious if we're having vacancies and trouble filling some of the pre-existing ones. Okay. So my other question is, I can't remember because you went through that list so fast, but do we have anyone from corrections?
No.
Not corrections per se. The only, we have sheriffs and chiefs, which is law enforcement, but not, if you mean corrections like from the prison system or the jail, no, that's not considered. That's not part of the list right now.
Well, I'd like to add that to the list. Because we providers deal with people that are in corrections or coming out of correction. Like I had one today. And they're not getting, things are getting better, I think, but they're not, they have a long ways to go to getting these people into treatment.
Okay. Well, we'll add it to the list for continued conversation. I'm not going to poo-poo any idea that comes out right now. The only suggestion that I will make is that we have to remember, as was said a second ago, that the larger this committee gets, the more it takes to have a quorum, but even beyond that, the more unwieldy it may become in terms of trying to get things done.
Yeah.
We have great support that helps us get things done right now, and we would obviously be leaning on them even more, but that's just something to keep in mind.
If I can just add, I made the suggestion for a representative from fire EMS, because currently from the first responder community, we have law enforcement, but we don't have fire EMS, and they bring a slightly different perspective. And as you've heard with some of the bridge programs and those things that are going on, I think they would bring a significant voice to the group. And the other representative of a member of Family Services Foster Care, in a conversation with one of the SURG members, they saw a presentation from the foster kinship group, and due to issues surrounding substance use, a lot of children are ending up in the foster care system, whether that's because the parents have died from an overdose or because they have been arrested or they have been taken from the family from child endangerment. So that's where that recommendation came from.
And I've heard from a former colleague of mine, Senator Patricia Farley, who has specifically mentioned the need for foster care conversations to be included in the opioid epidemic conversation. So I know that others share that concern. And we've talked about that among ourselves, but there's not been, to my knowledge, a person who's speaking from the foster care perspective. And so I don't have a problem with considering that addition either.
So my next, Dr. Dixon, for the record, my next question is, what do we mean by representative of the public? I mean, how do we choose a public person? I mean, we already have family members and,
We do, right.
and people with substance abuse history, I think.
Who made the suggestion that we add representative of the public to the list? Or was this just a brainstorm list?
This was just a branch from the list. And also, I know in the past, we've had members who've left because they've left their positions. So they had to leave the surge because they no longer, and they had interest or even I guess, an unbiased member of the public who maybe doesn't have, was the thought.
Jessica Johnson, for the record, I just want to say thank you for the discussion. I know that was my original piece. I really appreciate that.
Look, I think that's fine. And I don't think we are required to make, and I would not entertain a motion frankly right now to vote these up or down. I think this could be a refined list over the course of the next few months. There will come a time when we have to submit bill draft requests. And I think that if I remember correctly, that's around September for my office at least. And we have legislators who are also on this committee and they themselves may have earlier deadlines, but we have more time to talk about this and kind of filter it down and flesh it out more.
Thank you.
Any further conversation on that, either from online or up north?
Chair Ford, Kelly Marshall for the record. Debbie Nadler has her hand raised.
All right, go ahead, Debbie.
Oh, I forgot to lower it because that was my question too about the public. I thought that was too vague, but y'all answered that. Thank you. Sorry.
Okay. All right, so then I take it there on any other hands raised?
Well,
Oh, go ahead, Doctor.
talking with my colleague, one of the things would be, since workforce is a big issue, maybe somebody from the academic community that's involved in teaching people to do this, like, like from the universities or something like that.
From a workforce perspective, you're saying?
Yeah, the people who may not be university based.
I'm sorry.
Dr. Morenstrom, for the record, we work together and have done trainings throughout the state with regard to the diagnosis and treatment of various substance use disorders, and particularly around MAT. So I think to have that representation would be important because we're talking about issues of increasing knowledge, skills, and provision of services.
Yeah, no, I appreciate that. And, what's interesting in the context of the MAT phrase you just used is we just passed a law requiring, to the extent funds are possible, for corrections facilities to utilize MAT, right? And so this, I think, does fold into the conversation nicely. What I'd like to do is those who have made these suggestions for the particular additions, please spend time between now and maybe the next meeting or the next couple of meetings in drafting up a rationale for it so that we can have a more fleshed out discussion with something in writing so folks understand what's happening and what we're talking about and what utility these individuals will be bringing. And I'll ask the same of the prosecuting attorneys. I think some of these are kind of self-explanatory, but I think it'd be useful to have for the record something in writing that justifies why we're asking the legislature to add these individuals to the committee. Okay. All right, then we will move on to agenda item number 7, which is the approval of our SURG annual report and the discussion of distribution. We've allotted 20 minutes for this. I will be discussing this along with Kelly. We discussed at the last meeting the possibility of distributing this through a press release and or even a press conference or a presentation to different stakeholders, in addition to testifying before some of the interim committees, just to get the word out more than simply putting it up on the AG's website. And I'm still open and amenable to doing all of that. So I know we have at least one amendment that we're going to have to make to this report, and that's at the link on page 69. But we have 20 minutes for opening up discussion on this. Comments, concerns, complaints, additions, whatever the case may be.
Chairman Ford, this is Eric Schoen.
Yes, sir. Mr. Vice Chair.
Yes, I have a couple of ideas. We have a couple
Sorry, go ahead.
Sure, I liked it, but I think that's actually Steve's title. So I have a couple of ideas. We have a few different groups out there that are already doing really great work, kind of in the same direction that we are. One is the Regional Behavioral Health Policy Boards. So I would think it would behoove us to share a copy of this report with them for consideration at their meetings to see if any of their priorities would align with our priorities for next legislative session. So that's one group. The other group would be the prevention coalitions, of which there there are, I think about 15 throughout the state. Because at least a couple of the priorities that we've identified are pretty high level. I think they would be interested in knowing about those and helping along the way as well. So making sure we share the report with that group as well.
Thank you for those suggestions. We will certainly take you up on those. We jotted those down. Any thoughts on the report itself? Anyone see any problems or changes that need to be made?
Chair Ford.
Give me a second. Let's go to Jessica and then look.
And Miss Edwards.
Okay. All right, we'll come to them in just a second. Let's start with Jessica Johnson here.
Yeah, thank you. Jessica Johnson for the record. I was hoping to hear a comment from the SEI staff. I know at the last meeting, we ranked the priorities and then the recommendations. I was wondering if they're listed in different orders throughout this report, if the staff could just kind of walk us through that, or the recommendations that are in the executive summary, do they mirror the ones as we go through? So if I say recommendation 1 from page 3, it's the same one, it's the same number 1 recommendation throughout. And if not, if you could walk me through that.
So Kelly and Marshall, for the record, our understanding and belief is that it is, but this would be the perfect opportunity where if you see that there is a disconnect, to let us know, since we've been through so many versions of this report. But yes, the recommendations listed under 2023 recommendations executive summary are then found in the body of the report in the same order. The one thing I would note is that I believe there's 18 recommendations, and then there's 2 that are unranked, and there's explanatory language about that. And I'm happy to summarize any changes between December and January. There were some changes that were made that are being brought forward for your consideration, including the change of the link. So at whatever time, AG Ford, you would like me to review those changes, I'm happy to do so.
You know, why don't you go ahead and do that now? Because that may answer some of the questions that may be forthcoming. So you go ahead and do that, Kelly.
Okay, great. So if we can start, Crystal, I think we would go to the document for recommendation 13. So recommendation 13, as you saw it previously, included the recommendation as listed in bold. So you see establish a statewide initiative, and you have 4 bullet points below it that describe the parameters for the initiative. We did not have justification or background. This was one that was workshopped by the prevention subcommittee. So if you look at the bullet point under justification background, it says this recommendation was workshop by the prevention subcommittee from recommendation submission by prevention vice chair Schoen, chair Jessica Johnson, and SURG committee member Lisa Lee. It had actually been reviewed in August for an earlier submission. We did not have somebody who volunteered to workshop this, so we didn't have an actual justification for the recommendation. Emma from our team happily went back and looked at the justification that was initially provided with the recommendation and added that language above the bullet point under justification and background. So the first question for consideration is, are you comfortable with us taking the legacy information that was provided as a justification, which is that there is an increasingly unstable drug supply and potency can vary significantly from batch to batch? That paragraph, that is an addition that was not included in your December version. So we're suggesting that we put that in, and then we can either include that explanatory language that was previously listed saying this recommendation was workshop, or we can delete that. So that's question 1. The next thing is because this was not adopted and sponsored by any member after it was originally brought forward, there were not action steps. So one suggestion received was to take the parameters listed in the recommendation, those 4 bullet points above, that fall under includes the following parameters, beginning with work with harm reduction community. and list those as action steps because they are action-oriented items. So for the group's consideration, you could choose to revise the recommendation so that it simply reads, establish a statewide initiative for community drug checking that incorporates qualitative and quantitative drug checking, period. Or you could retain it as is and say it includes the following parameters and either include those action steps or not. So our second question is, do you want to revise the recommendation to take out work with harm reduction and those subsequent bullet points and list those as action steps, or leave the recommendation as is and list them as action steps or not provide any action steps? The third issue also appears for the same reason, which is that we didn't have somebody to build out the impact, capacity, feasibility, urgency, and how the recommendation advances racial and health equity. And it was suggested that we list that as in progress and circle back to that, or we could list it, just have it as blank. So those are three changes. I'm happy to walk through them individually or just hear from the SURG members if they have an opinion about whether we should revise this recommendation, include the justification, include action steps, and include the statement in progress. And do we include those 4 bullet points as part of the recommendation and the action step?
Thank you, Kelly. You've done a good job of explaining this in my mind, at least. And I will come as no surprise, have an opinion. But before I express my opinion, let me see if Vice Chair Sean and Jessica Johnson. No, I'm talking about
He's right. Okay,
from
sorry.
this. And Lisa's not on screen, but you know, I wonder if you two might want to chime in to see if this satisfies, you know, your purposes or you have some different opinion. Go ahead.
Yeah, wonderful. Jessica Johnson for the record. Eric, is it okay if I go first?
Please do, yes.
Wonderful. Thank you so much. So I just wanted to, at the outset of this, just recognize the excellent contributions, I believe, of the prevention subcommittee in the 2023 year that both took on the bigger prevention recommendations and the additional larger committee harm reduction recommendations as an addition of the volume of review for our committee. And a big thank you to my colleagues on that particular subcommittee and the others from other subcommittees who did weigh in on the harm reduction recommendations. My initial thought from Kelly is to one, incorporate some of the legacy information that was part of the discussion of that group. We were tasked with both discussion of these items and adding to the SurveyMonkey survey and kind of multiple touch points. So if the committee is open to that, I think some of this legacy information is valuable and sort of how we arrived at where this is at. Additionally, I would recommend keeping the parameters in bold at the top and including them as action steps. I think that sort of makes sense with the way that this would, like, at least where we got to in the thought process of this particular conceptualization, both as a larger committee and as a committee workshopping and making recommendations on these additional areas. And then really for question 3, open to either in progress or leaving it blank depending on the decision of the committee. But yeah, thank you.
Okay. Mr. Sean.
Yes, thank you. I that's why I like having Jessica go first. She's so well spoken. She summarizes things so well. I would echo everything that she said. What I remember from our conversation about this recommendation in the prevention subcommittee is that there were really 2 levels of benefit that we thought we could accrue from drug checking. One was for those who are using the drugs themselves. So they would have data about whatever they're using to be able to keep themselves as safe as possible. Secondarily, there would be a meta level of data across the board. We would have a better idea of what exactly is flowing through the drug supply in Nevada at a large scale, and we would be in a better position to respond and to provide the supports needed or the education needed. I don't see as much towards that second benefit in what we have here so far. I think it could be either added as an action step or as part of the justification background, but something that speaks to those two different levels of benefit that I think as a prevention subcommittee, we thought could accrue from this.
So that I'm clear, you're suggesting that additional language be added to what we have here on page 21.
Yeah, well, so I think this does a good job of and maybe it's the way that I'm reading it, and maybe others are reading it differently. But I think this really speaks to the first level of benefit for those who are actively using the drugs and would have their drugs tested or could have them tested in a timely way to have the additional information to know whether or not this is a harmful batch of drugs, but they shouldn't be touching at all, or it doesn't have any adulterants in it. They could feel relatively safe about using whatever batch of drugs they have. So that's level number one. Level number two is if we have a way of collecting this data as like a dashboard, and these different testing agencies are reporting the adulterants and the other sorts of things that we're seeing in the drug supply, that's a helpful, topical level of data that we haven't necessarily had access to before. And it could help us to inform our interventions, how we allocate resources. I think if we had a little bit more in there, because what I like about the data that's provided, by the way, I'm a fan of what I see here, is I think it provides a nice breadcrumb trail for people who might want to take this forward and really kind of develop it. I'd like to make sure that we have clearly articulated what we anticipate the second level of benefit would be for the community at large and how we might be able to do more tailored interventions depending on what we're seeing from the data that's being provided.
Okay. Okay, I appreciate that. I'm going to circle back with some thoughts in a second, but let me open it back up to the committee for any additional thoughts on this. Any on the screen on this particular issue? Okay, so here's what I would suggest we do. If Mr. Schoen and Ms. Johnson will be amenable to this, drafting up the second justification point you're talking about there, of the second level of benefit, submitting it to Kathy for inclusion under the justification background component, and the committee being okay with you doing it and us adopting this report, subject to those revisions and submission to Kathy. Does that make sense?
To Kelly.
To Kelly. I'm making all kind of names up today. To Kelly.
So
I'm looking at
Kelly
council
Marshall,
right quick.
for the record, Mr. Schoen, what I recorded as your statement was that potentially we could add a sentence that says, additionally, collection of this data as a dashboard reported to the public could inform tailored community interventions and resources.
You make me sound so much. Yeah, that's brilliant. That's great. I'll take credit for that.
Sound like it's done then. Okay. Good job. No, Jessica, you want to ask something else?
Yeah, Jessica Johnson for the record. If we were going down Chair Ford suggested route, I was gonna offer to also draft some language around the in progress about the impact of capacity feasibility and how we're advancing racial and health equity to fill this out. But if we're adapting it in this meeting today and there's no need for follow-up, then happy to follow the guidance of the committee.
I'll tell you, unless my counsel tells me otherwise, I would much rather prefer to have the in progress spelled out. And so I would like for you to do what you just suggested and then give it to Kelly, not Kathy. And then the committee, if he says I can do this, just adopt this at the end of the day, subject to these recommendations or these revisions.
Yes, I think that could be done. That's what I was going to ask too. Yeah, if there was going to be, there seems to be a lot of changes. So I don't know if you wanted to just not approve this and bring it around for next time.
Well, I think our report is due by the end of this month.
Oh, then in that case, then if all the recommendations are out there on the table now, then I suppose you could vote to approve this, incorporating all of the mentioned recommendations.
Okay. And I don't hear a lot of changes. I mean, we're going to change the website. We're going to look at page 21 and, adopt a couple of things here. There may be others, but For our purposes right now, I think that's the way we'll proceed. Okay?
Chair, Senator Severs Ganser has her hand raised and has been waiting patiently.
Okay, but is it on this particular topic or is it on a different topic, Senator?
It's on the annual report. So I was waiting till you were done with the last.
Okay, yeah, well, I will come to you. Okay, let me finish this up then to be certain that we're good on this front. And I think we are. Okay, good. Thank you. All right, Senator, mic's yours.
Okay, let's see. I still have it. I've got it off mute and my hand, I'll put my hand down. Okay. So thank you. So, my issues around transparency, and I appreciate all the work this committee has done and all the advocates. It's been tremendous. When I'm looking at the report, page 70 has the update on the opioid funds, and there's a link on page 70 that brings you to Vital, I think it's Vital Nevada, which has a pie chart. And the pie chart talks about how the money's distributed and being used, but it doesn't talk about the attorney's expenses and the costs that we've incurred across the state itself, but also the different municipalities and subdivisions of the state. And I think it's really important that that information is disclosed. I recognize that there's an annual report the Attorney General puts out on those, and I haven't seen this year's, but last year's there were some errors in it. But the funds are substantial, and I think the public needs to be made aware of how much has been paid. For instance, of the 1.137 billion that we've received or expect to receive, there is about $290 million that will go to attorneys for fees and costs. And for the state's piece of 434 million, the fees and costs are about almost 79 million. So I think we need to have more transparency around that and shed some light on that, because every single dollar is important. And when we're spending them on attorneys' fees and costs associated with these are national lawsuits, those are dollars that can't be used for prevention and to help folks. So I think the annual report, while it links to the Vital statistics, doesn't really talk about the costs, and I think we need to shed light on that. So that's my proposal.
Well, your position on the attorney's fees has been made loud and clear several times, both in this meeting and elsewhere. Your disapproval of us utilizing outside counsel to recover this monies for the community has likewise been well documented. It's been documented for the record here as well, again. And as I have said to you before and said on this record, transparency is not an issue for this office or for this committee. What I will ask is, if Mark is on the screen, if what you are asking for is capable of being done at this juncture, and if not, it will have to wait. Mark, are you able to respond this juncture?
Thank you. I just wanted to add that Mark has been exceptional, because when I've requested the information, he's provided it, but it's not publicly available. So even when we have reports in this meeting, they're never included as part of the package. There's a reference to that that he's going to speak to the settlements, but the documents, the spreadsheets are never provided in a written form that you can look up later. And that's why I actually contacted him originally, is because I saw the spreadsheets online here in one of our meetings, but then they were not accessible to me. So yes, I appreciate, but I just want to make sure that it's understood that Mark's been extremely helpful. And if you request the information, you can get it, but it's not publicly available without request.
Yeah, you're exactly right. Mark, on behalf of this office, has been entirely transparent and responsive to any time you've ever asked for anything. And from the public will likewise be responsive. It is available to the public upon request, as you've indicated. And in fact, there is a link that is being worked on right now to have it go up on the Attorney General's website without someone having to ask for purposes of addressing this type of contention going forward. So we'll go back to what Mark said a second ago, what I said a second ago, and say Mark is capable of responding to your request, and we'll go from there. Mark?
And thank you, Mark Kruger, for the record, Chief Deputy Attorney General. And I know that my particular agenda item isn't coming up till a little bit later, but some of this will dovetail into it. We are working on a link to be able to get that report up and get it updated regularly so that people can access it whenever necessary. Senator, I appreciate you reaching out early on, because I think we've developed a chart that really is transparent, and it shows all the dollars where they've come in. Remember that we really only deal with the dollars that come in, whereas this committee and a lot of other organizations, including DHHS, deal with the dollars going out, which is going to be part of my report. So I think other than getting that link where then they could incorporate it on here, I think that would resolve your concern.
I that would be very helpful. And again, as I mentioned earlier, you've been very responsive. I think it's the amount of dollars that just needs to be, the light needs to be on that, because this work is so important and all the advocates on this call know that. So thank you.
All right, anything further, Senator?
No.
All right, moving on then. Who's next in the queue? Kelly?
Or Kelly Marshall, for the record, I don't see any other hands raised. I do have just two more items I wanted to note in terms of changes or notations for the report prior to the adoption.
Yes, ma'am. Go ahead.
All right. So the next item comes up as Appendix B, and this is just something for the SURG's consideration. We asked SURG members to go through and identify specific populations as required through the legislation that are impacted by the recommendations made each year by the SURG. I would just note that we do not have any specific subpopulations noted for item 8. So this is in the appendix. It's an Appendix B. And you can see there's X marks that show on a prior recommendation, such as 6 and 7 on your screen. Oh, this recommendation impacts, pregnant women and the parents of dependent children, for example. So under recommendation 8 for supporting harm reduction through implementing changes to recruitment, retention, and compensation of health. And Crystal, can you just scroll down so we can see the rest of that recommendation? Health and behavioral health care workers. It's such a general recommendation that it could apply to all categories, right? Because people of all subpopulations could be impacted by having a greater workforce. And then, or we could just continue to leave it blank. I just wanted to note that for the SURG before you adopt the final report. And then the final recommendation, which is an unranked recommendation, really, from my perspective, it's probably for the same reason. It's such a broad systems level recommendation that you can see unranked, recommend the Nevada System of Higher Education conduct a feasibility study to understand the true cost of implementing wastewater-based epidemiology in Nevada, et cetera. Again, doesn't directly apply to any specific population. So if the SURG is comfortable leaving those 2 rows unmarked, we will leave it that way. Or the other approach would be to say, this would impact all subpopulations and we should mark every subpopulation category, even though it's a very high systems level issue. So that is the second issue. And then the third issue was the one previously discussed already, which is for us to update the link in Appendix E, I believe. Yes. And we would then go to a different page. So Crystal, I'm not sure if you have that link and you can share that page as well. But the new link provided by the Attorney General's office takes us to a place that has the list or the description of AB 374. So it has the legislation, then it has the SURG bylaws, and then it has the appointments. And we used that previously on this meeting to determine the different categories that our current SURG members represent. So we're just suggesting you swap out this link with the link that we had previously in the report. And those constitute the changes that were made since the SURG reviewed the report in December, but they were provided with the exception of the link, which was only available today. So again, the question is, do we leave Appendix B the way it is with those 2 recommendations that are high systems level blank, or do we mark every category? And then can we update the link to take it to that page. And I see
On
that,
the link,
oh, go ahead.
on the link component, you can certainly update the link. I think I can speak for everyone in that regard. But you have, did you say you have someone ready to speak?
Both Debbie Nadler and Mr. Schoen in that order have their hands raised.
Okay, go ahead, Debbie.
Hi, thank you so much for doing all this. Could you do me a favor so I can see it? Can you go back to the top? I think it's number 5. Sorry. Yeah, I'm pretty sure it's 5. If you could scroll all the way up.
I'm sorry, I'm not sure I'm following. Kelly Marshall.
Oh, the recommendations where it
Okay.
starts with 1 with the schools, 2,
Yeah.
what we voted on the last time.
Mhm.
Sorry, I should have taken a screenshot of it real quick, but I know, I remember the last time when we were voting. No, I'm sorry, it's not in that box. It's where the blue boxes are further down something about
there a particular page
tobacco.
number you have?
It was the tobacco is further up now. It was at the bottom
Page
last
40.
time. About the 15% for tobacco, the Nevada tobacco control. That recommendation number 5 was at the bottom before. I'm just curious how it got to be number 5. I forget a lot of things, but I don't forget that one. Sorry.
Yeah. So Laura, I was gonna ask you if you could respond to that.
Yeah, so you have a handout in the documents that were provided. It's called the SURG Preliminary Recommendation Rankings from December 13, 2023. And it shows the results, ranked scores in descending order. And then at the bottom of that, the very last page of that, page 6, has how each member ranked those.
Okay. I didn't see that. I know we had to vote again because some of our names didn't come through. I just remember the first time that was at the very bottom.
So Laura, I think if I understand Ms. Nadler's question, it's did that move in ranking since what we did in December?
Thank you.
I trust what she's saying is that it did. I don't know off the top of my head that's, I can't confirm that. I don't have that document in front of me, but we can certainly check that. But you can confirm it by looking at how individual members voted if you'd like to, using that document that's on screen now. The very last page of that, page 6, shows you how everybody voted. And that particular recommendation was PS2. So you can look for PS2 in that table, and you can see how people rank that, if that helps. So you had a number, you had members that ranked it as their second top priority. Other people ranked it, you can just go through and pick those out there if that makes sense, Ms. Nadler.
Yeah, it does. Thank you. Thank you.
You're welcome.
All right, thank you. And then there was a question after that. Mr. Schoen, was it?
Yeah, not a question, but a comment on what Kelly was asking about before for whether or not we should check all the populations or none of the populations. I don't have an opinion on the wastewater one because that's not my area of expertise, but nor my necessarily my area of passion. My area of passion really is expanding the level of the number of paraprofessionals because I think it's a crucial area where if we increase those enough, I think we can make a significant difference for all of those populations. And really, that's one of the benefits of these 3 different professions is that they can be tailored for each of these professions to provide specific support, whether it's seniors or whether it's the folks who are in recovery themselves, or children or families. The idea is that there would oftentimes be a shared frame of reference that would provide extra therapeutic value to the work, to the support being offered. So in the case of number 8, I would be in favor of checking all of those different populations, because I think it is one of those strategies that would cut across all of these different interest groups. But that's just my opinion. Other people may have other thoughts on that.
I was actually going to ask the harm reduction folks what they thought on that. I tend to agree with you that it touches on all, so they all should be checked, but I'm open to other thoughts on this.
So Ms. Holmes has her hand up.
Okay, Ms. Holmes.
Thank you. Shayla Holmes for the record. I am in agreement with Eric Schoen in regards to checking all the boxes. And when it comes to the wastewater epidemiology, its impact would be reflective of the areas where that data was being collected. So it would be impactful to have that data and knowledge. And I think it would equally check all of the boxes for all of those demographics if those demographics are present in the area where the wastewater is being collected. So I think there is a valid point similar to Eric's point in regards to these professions having impact, because they would be out doing broader reaches. The wastewater epidemiology would be very similar, and ways of which that data could be utilized to better prepare communities to respond.
Okay, thank you for that. So here's how I'll approach this. Are there any objections to putting X's beside all the boxes for these two? Speak now, if so. Okay, so it sounds like the consensus then is that we can put X's by all of them, Kelly, for both number 8 and the wastewater one, whatever number that was, 13, I think it was.
Yeah, no, it's the unranked final.
Unranked. Yeah, unranked. My bad. Okay. Okay. So I think that answers the outstanding questions you have for us. Is that right, Kelly?
That is correct.
Okay. Okay. I think we went well over the time we allotted for this, but we did save some time earlier. And with that, I think we've had a robust discussion. I would entertain a motion to adopt this report as amended based on today's conversation.
Assemblywoman Thomas, so moved.
Okay, who was that?
Assemblywoman Thomas.
Okay, thank you. I have a motion. Do I have a second?
Jeff Iverson for the record. I will second.
All right, thanks, Mr. Iverson. We have a motion it's been moved and properly seconded that we adopt this report as amended and discussed today. Any discussion on the motion? Hearing and seeing none, all in favor say aye.
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 Any opposed, say nay. Any abstentions? Motion carries unanimously. Thanks so much, everybody. Great work on that. It is 3:24. Let's take a 6-minute break and come back at 3:30, everybody. All right, everybody. We're at 3:30. Let's come back to order and go to agenda item number 8, which is an update on opioid litigation, settlement funds, and distribution. Mr. Kruger, you there?
I'm here, General Ford. Thank you. Mark Kruger for the record. So I've got just a couple things to report this time. I know it's been, it's nice to kind of wrap up the year with some totals. When I focus in on just the state of Nevada's recoveries, one of the important things is how much money has actually gone into the Fund for Resilient Nevada. And what we have is up to the end of the year, 2023, $66 million in change has actually been transferred into that Fund for Resilient Nevada. The good news is, and I think the senator will appreciate this, is that we actually applied for some fee funds under some of the national settlements that we joined, and I was expecting to get only about 16 million from these fee funds. And in fact, we got $22 million from the fee funds, which offsets a lot of the fees, some of the fees that we've paid. But that will all go directly into the Fund for Resilient Nevada. And that's the state's fees, because it was a state's fee funds that we apply to. So with that amount that I'm going to be transferring in this January, we'll have $88 million into that fund. So that brings me to a second point, which is one that I think is becoming an issue that you see in the news quite a bit, and that is, what are we doing to spend the funds? Obviously, we don't get into that as the Attorney General's office. That's really Department of Health and Human Services. And I know that they are doing a good job trying to ensure that the funds are braided, that they are used in the most efficient manner to truly do the most work and get the most bang for the buck for this. But one of the things that we have noticed is that we are getting a lot of questions. Can we get the reports? And it seems that people want to see in more real time the reporting. Well, I'm pleased to announce that our office has been working diligently in putting together and building an actual program that's going to hopefully, when it's done, and it probably won't be done for another couple months yet, maybe even 3 or 4, but it's in the process. And what it does is it's going to allow the signatories of the One Nevada Agreement to report into the program electronically. Basically, it's cloud-based, and for DHHS to then use those reports and produce their annual report that they have to produce. Well, what we asked the IT department to do is leave a public dashboard so that anyone could go into that and see what's been reported and pull the information themselves, which will really go to a lot to getting the information out a little bit faster, especially since it will allow real-time reporting. Now we have no control over the local governments, how fast they're going to report in, on the use of the funds. But at least it's a very transparent mechanism and a way for people to get to that information, since it seems to be gathering a lot of attention these days. So those are the primary 2 things that I wanted to report, General, and the committee. And if you have any questions, I'll go ahead and take them now.
Questions from the committee? Debating in my mind how best to say this. Mark, let me say at the outset, thank you again for your diligence and all of this work. You've been responsive, you've been transparent, you've done everything asked of you by me and also members of this committee. Thank you for taking it upon yourself and working with IT to ensure that we could even go above and beyond what's requested and required of this office. By creating this dashboard. It is not our responsibility to do it. I want to be clear about this. This is something that our office has decided to take upon ourselves to do, and we're doing it because there's been a lot of misinformation out there, a lot of lies and innuendo and ad nauseum attacks in the media around the expenditures of these funds, around costs and litigation, around attorney's fees, and it's frankly problematic. And it's not just an attack on the Attorney General, it's an attack on this agency and those of us who work at this agency. And I want to say in front of everybody and for the record, Mark, I got your back and I appreciate the work that you're doing. And anyone out there who has questions around transparency, bring them on. We've done everything that we can to be as transparent as possible. And we brought in over $1.2 billion in total. You take out some attorney's fees and you still have $700 million of attorney's fees, of opioid funding coming in over the course of the next 20 some odd years. And so thank you again for the yeoman's work. Thank you for weathering the attacks along with me and the rest of this office. Just keep up the good work, sir.
Thanks, General. I do want to point out one misconception, and that is, or something that actually we can brag about, and that is, as a state, we've been the hardest hit, one of the hardest hits. But as a state in the litigation of opioids, we're also one of the ones that brought in per capita more money than some of the other states, many of the other states. And that just is a testament to the hard work that we did in our opioids litigation. But it also is something that shows that the amount of recovery per dollar of attorney's fees we would not have gotten those dollars in recoveries. And, it's difficult to figure out the exact dollar amounts for many factors, many reasons. But I would conservatively estimate it at least $600 million. that we would have had less had we not done outside contingency fee counsel. So, there's different ways of looking at this stuff. And I get it, and a lot of people have different feelings about it, but I can unequivocally tell you that the state of Nevada's opioid litigation was very successful. And it represents a valiant effort to be able to give these monies to programs and services that are really going to help people.
Thanks, Mark.
Jeff Iverson for the record.
Yes.
Can I
I'm
just
sorry,
make a
who was
quick
that?
comment? Jeff
Yes,
Iverson.
sir. Go ahead, Jeff.
I just wanted to make a quick comment too. I've heard some of the scuttlebutt, and I wanted to send a vote of sincere appreciation to both you and Mark and everyone in your office that's worked so hard. I think it's unfortunate that a lot of people don't really understand the process of how this all works. And I think that in the end, everyone is going to realize that the hard work is going to pay off and the recommendations that are brought forward make sense. And ultimately, there's a light at the end of the tunnel here. So I just want to say thank you very much also.
Thank you, Jeff. I appreciate that. Ms. Johnson.
Yeah, thank you so much. Jessica Johnson for the record. Mr. Kruger, I'm very excited about this dashboard. Really, I think and happy to, promote it here at the community level to help answer any questions that we've heard, that we've, relayed on behalf of serving on the SURG, at least what's been presented to me as a member, and also where folks can find out more information. Did you mention, is there a timeline with the particular dashboard or an optimistic thing that you're looking at? I know how those things work sometimes. Thank you.
No, I appreciate Mark Kruger for the record, and that's a great question. The dashboard is really something that we decided just recently to add to it. So I don't know how long it's going to take IT to build this. They're in the process of doing it, but they believe that they're going to be able to get definitely within the next quarter or so, in 3 or 4 months. It may take a little bit longer, but if we look forward to this, being an actual ongoing, it'll be much before the 2024 report, right? So you'll be actually able to get on there way before then. So I would say, at the latest 6 months, but let's be optimistic and think 3 months. Also, if I didn't give a shout out to Dawn Yohe at the Department of Health and Human Services, has been instrumental in the report. She is the one that truly is doing the report work. We bring the money in, but she's over at DHHS doing it. And she's done a fantastic job, collaborated with myself and with our IT department to put this together so that she can be in control of this thing, and really make sure that the reports are coming in. And then the counties and the cities, the signatories to the One Nevada Agreement, have been fantastic. I've really developed a great working relationship with them. And when we need stuff, we reach out, and they're very, very responsive. So I also want to give a shout out to them. But anyway, thank you again. And yeah, I think about 3 to 4 months, optimistically, but it should be there.
Thank you.
Thanks, Mark. Any final questions before we move on to agenda item number 9?
Attorney General Ford, Claire, Assemblywoman Thomas and Senator Severs Gansert have had their hands up.
Okay, Ms. Thomas, go ahead.
Thank you, Chair Ford. I didn't want to say anything other than I ditto everything that you said. It expressed my thoughts, and I am also proud of the fact that your office has taken the initiative to make everything transparent, so that, but we all know that even with transparency, we will have naysayers. So, thumbs up to your office and you.
Thank you, Assemblywoman. Madam Senator.
Thank you. And I wanted to express my appreciation for Mark's work in recouping some of the attorney's fees. And when we talk about the attorney's fees, I appreciate that we're going to have more transparency around that. And just to note, many states have caps of 15% on an outside counsel attorney fees, and the state of Nevada is 25%. So he faced a challenge when he was trying to do the contracts, because in 2017, during a conference committee, the the maximum that could be paid was increased from a much, much lower amount to 25%. And again, probably half dozen states have caps of 15%. So the amount of attorney's fees is partially driven by statute. And I know I've worked on trying to get that changed. So I just think it's important for people to understand that when you look at $1.137 billion that come into the state, if you've got a cap of 15% versus 25%, that 10% is $100 million. And that's why I've been arguing about it. That's why I'm asking for more transparency so that we all understand where those dollars went. It's not about using outside counsel. It's about how much we pay for outside counsel and what's a reasonable amount. So I want to, again, thank Mark for his efforts and the Attorney General's office for the work that they have done. But we have to be transparent about what we're paying for that work. Thank you.
Thank you, and you're welcome on behalf of the office for the work we've done. And if we're talking about history, let's just talk about the history of the statute. I'm sorry, guys, we're gonna get done with this in a minute. It was changed in 2015. There was no cap, and then it was lowered to 10%, I think it was. No one's taking a contingency case for 10%. They're not taking it for 15%. Now for an opioid piece of litigation that costs upwards of hundreds of millions of dollars of litigation costs. And so negotiating down from 25 even was a yeoman's job that Mark did. We're paying 22% at the top. And so at the end of the day, the work we've done in this office under the statutory provisions allowed are bringing in hundreds of millions of dollars to help folks who are affected by opioids. Irrespective of what you think about contingency counsel and whatnot, that's what has happened here. And again, what has happened in the media has been erroneous. It's been misleading. It's been ad nauseam attacks. And it's not, again, not just an attack on the Attorney General, it's an attack on this office, and I won't stand for it. So with that, we're gonna move on to agenda item number 9, the bylaws attendance policy, and Dr. Kearns.
Thank you. Just because we have some new members and we've had some turnover, we just wanted to address from our bylaws the attendance policy. And the first one, as you note here, is that SURG members shall, to their extent practicable, inform administrative staff, that being the SEI staff or myself, at least 4 business days in advance of an anticipated absence. And really the primary reason we're asking for that is to look at quorum issues, so that if we know that we aren't going to be able to meet quorum because we have people who are letting us know they won't be there, we can move that meeting to a different date. So it helps for that, and that's the main reason for that. The next attendance policy is participation. Again, according to the bylaws, members shall participate in at least 75% of the meetings, and any absence without sufficient or overriding reason will be disclosed to the appointing authority in accordance with Article 4, Section 6, and may result in removal. And again, talking about that 4-day policy, what I do want to talk to you about is excused absences, and that's that 4 days of advance notice. If someone does give us advance notice and it is an excused absence, that excused absence still does count against our quorum. So again, going back to looking to make sure that we have quorum. If someone is not participating, we don't want that representative to be taking a spot of somebody who would be participating. So that's why the 75%, so that it can be brought to the appointing authority if they want to reach out to that person, see if they're still interested. If there's something else going on, they can't still be on the committee, that we could seek getting someone else into that position that would be a active participant of the committee. And I do want to say that the 75% requirement, in talking to our DAG, Rosalie Bordalove, is it's 75% of that body. And what I mean by that is 75% for your participation in the SURG, but then if you're on a subcommittee, it would be 75% of your participation in that subcommittee. It's not a total of all of them, it's for whatever you're participating. Everyone's a member of the SURG, not everyone is a member of a subcommittee. So if you are a member of subcommittee and you do miss, that wouldn't go toward your SURG participation, just to let you know that. And then also, I've pushed it to our DAG to look at what that period is, if it's the period of your appointment. So now we're to the point where everyone's appointments are 2 years, with those being different so odd year, even year, who comes in and out. So we have to look, because we wondered the question if it's an annual 75% or if it's for the term. So we'll get an answer back from our DAG on that, and I'll address that in the next meeting. And then the last one is lengthy absences. If someone, say, is on family, medical, and sick leave, and they know they're not going to be able to attend meetings for a long time, their absence still does count against quorum, but because they would be excused absences, whether it would be to the appointing authority about replacing them or not. But if we have a vacancy, which we do not have now, that vacancy does not count against quorum. So I just wanted to highlight that for everyone in terms of your attendance and your participation in the SURG and subcommittees.
Thanks, Dr. Kearns. Any questions? Thank you so much. All right, moving on to agenda item number 10, proposed 2024 subcommittee membership and meeting schedule. So I am to reappoint subcommittee members, chairs and vice chairs. Second here, sorry, lost my notes.
Yeah, what we did want to do at this point is, I know in some past meetings, there was discussion that there may be members who want to be on a different subcommittee, or we may have new members that are not assigned to a subcommittee that may want to be on a subcommittee. So at this point, we just wanted to ascertain if everyone's happy with the subcommittee they're on, or if they want to be a member of a different subcommittee, or if there's any member that's not on a subcommittee that wanted to be on a subcommittee.
Thank you. And the current membership list is on the screen, and you may have it in your packet there. So please chime in.
Yeah. And then also you'll note up there currently who the chair and the vice chair of each of the subcommittees are. If someone wanted to not be a chair or a vice chair.
You need a chair for treatment and recovery. Who's the chair there?
Who's Lisa?
It was Lisa Lee, huh?
I thought Steve Shell was gonna.
Steve, are you taking over the chairmanship of the treatment and recovery? You okay with that?
I'm fine with that, Chair Ford, unless one of my other fellow members would like to do it, but I'm okay either way.
Okay. All right, I'm going to appoint you chair. Is there a vice chair that someone wants to step into? Anyone wants to volunteer to be vice chair of the treatment and recovery subcommittee?
I will.
All right. Dr. Dixon, yeah, I was trying to read. Yeah, Dr. Dixon is going to be the vice chair, so we got that moving. Okay. My intention is to appoint these and move forward today. So if there are is anyone who wants to change committees or be removed from a committee, speak now or get ready to hold your peace.
Attorney General Ford,
Okay.
Debbie Nadler has her hand up.
Yeah, Debbie.
Hey, sorry, I didn't mean to raise it, but while I have the floor for a second, I just want to make sure y'all got me for attendance today. I was a few minutes late.
Oh, yeah, we got you.
Thank you.
We got you. Thank you. Okay. So and just a one fell swoop, I'm going to say, okay. And one fell swoop, I'm saying, here are your committee assignments. Prevention, you are Senator Donate, Ms. Johnson's the chair, Debbie Nadler, Angela Nichols, Vice Chair Schoen, and Senator Gansert. On prevention, treatment and recovery, the membership shall be Steve Shell is chair, Dr. Dixon is vice chair, Trustee Cheatham, Dorothy Edwards, Jeff Iverson, and Assemblywoman Thomas. For the response subcommittee, chair will be Dr. Kearns, vice chair, Shayla Holmes, and we'll have committee members of Nancy Lindler and Christine Payson. And we will look to hear from Assemblywoman Hardy. And I don't know if Dr. Slamowitz wants to join something at some other point, but we will go from there. Okay. With that, as a reminder, the subcommittee meeting frequency is going to be to meet between 5 to 6 times starting in February or March through November of 24. Subcommittees will meet virtually for about an hour and a half. Anything further on this agenda item?
No, I just want to thank all the subcommittee members because the majority of the work on these recommendations was done at the subcommittee level. So thank you for all of your work in getting those done.
Absolutely. Thank you so much. Okay, agenda item number 11, review and consider items for the next meeting. Discussion only. Any suggestions for Dr. Kearns? For the next meeting.
If you'll move to the next slide, please. We do have some agenda items slated, just as an update, the SURG member survey results, our subcommittee reports, a report on the Fund for Resilient Nevada update, and just to let you know, that did get pushed from this meeting to next because Dawn Yohe is getting the information from the counties on the use of their funding. So that's why we pushed that back. An update on the opioid litigation settlement funds and distribution, as Mark always does for us, and we appreciate that. And then some overarching presentations. And one, especially after some of the discussion I've heard today, is the DHHS has contracted with former captain of Las Vegas Metropolitan Police Department, Bill Teal, who is doing the Nevada jail OUD research overview. This is primarily looking at the rural and frontier jails. But what I listened to a presentation he gave, and just to let you know, it's looking at the capacity and gaps at those levels, and then also the suggestion of having multidisciplinary teams within the jails. So the work that he's already done, he's not finished, but I think it would be very important for the SURG to hear about the work he's doing, especially because we do have the recommendation about having the 3 FDA-approved MOUD in our jails. So that was one of the suggestions I had. And then also, I know that Eric Schoen had made reference to the regional behavioral health policy boards, and I did listen into one today, the Southern region, and there was a very interesting presentation that I suggest that we get. It was by Dr. Sarah Hunt, who's the Assistant Dean of Behavioral Health Sciences at the Kirk Kevorkian School of Medicine at UNLV. And it was an update on AB 37. And it was really looking at the establishment of the Behavioral Health Workforce Development Center of Nevada out of UNLV. I wasn't aware of this, so I thought this would be something significant as well, because we do have the recommendation looking at trying to really build up our workforce. So those were the 2 suggestions that I had for presentations for next meeting.
Great topics. Thanks for presenting those. Any other suggestions for now? Obviously, you can always email Terry between meetings for agenda suggestions. But any others for now?
Yeah, Chairman Ford, Sean. I want to keep on the agenda if we could, because I think it's important. This report will have traction to the degree that we can make sure that it's circulated. So I'd like to at least have an agenda item, whether that's a 5-minute or 15-minute conversation, so folks can continue to add their thoughts about what groups we could share this report with, how we can get the word out, just to make sure that it's seen by as many eyeballs as possible and makes the deepest impact as possible.
That's great. That's a great idea. And what I'm going to do is commit that to you all, that Dr. Kearns and I will have a conversation around distributing this between now and the next meeting. We'll keep a list of everywhere that it's going. And we will develop a game plan relative to a press conference and testifying before interim committees and whatnot, and present that. So that's part of the agenda. Let's do it that way.
Okay.
Okay, so that's a great point. Thank you for that. Any other suggestions? Okay. Hearing none, then we will move on to the next agenda item, which is public comment. Am I right? Yeah, public comment. Public comment shall be limited to 3 minutes per person. Members of the public may comment on any matter that is not specifically included in the agenda at this time. However, no action may be taken upon the matter raised under this agenda item until the matter itself has been specifically included on an agenda item as an item upon which action may be taken pursuant to our NRS. Any public comment? Here in, yes, sir, go ahead.
Giuseppe Mandel, American Dictionary of Desert Hope. Thank you guys all for allowing me to be here, and thank you for all the work you've done. And you know, I wasn't going to say anything, but I figured I would chime in. So with Attorney General and Mark, I mean, trust me, there are a lot of us in the recovery field, me as being a person with lived experience who's in recovery and a product of the opiate epidemic, as well as losing a family member due to opiates and stuff. And there's a lot of us in the field that we mentioned that do thank you guys for your support. And trust me, there's a lot of us, despite when anything is heard or rhetoric, that trust me, understand that, you know, 22% is well worth payment to private attorney funds for litigation funds. And we do have your back as well, us in the community. And we do thank you for all the hard work that you've done.
Thank you for your comments, sir. Any other public comment here in Las Vegas? All right, any up in Carson? All right, any on the screen or on the phone? Okay, hearing and seeing none, we are adjourned. Thanks, everybody. Have a great one. We'll see you next time.
Take care.
Hey, thank you so much. It was great. Thank you.
I know.
Yes.